All right, let's talk about something pretty much all of us have felt at some point. That sudden, strange, world-tilting sensation of being dizzy. You know that feeling, right? It's that bizarre, disorienting moment where everything just feels off. It can hit you when you stand up, turn your head, or sometimes for no reason at all. And yeah, it can be pretty scary. I mean, it involves your brain and your sense of balance, so it's totally natural for your mind to start racing, wondering, whoa, is this serious? Well, okay, let's just take a breath. Here's the most important thing to know right up front. Even though dizziness is a super common reason to see a doctor, the odds that it's caused by something really serious are actually very, very low. So let's try to swap some of that fear for a little bit of clarity. So, if you've ever felt this, you might be wondering if it's just you. Well, let's start by looking at just how common this whole experience really is. Check out this number, 35. A typical family doctor sees about 35 patients a year just for dizziness, and that's in just one doctor's office. It really drives home the point that you are definitely not alone in this. You know, the first, most crucial step to figuring out what's going on is to understand that dizziness isn't just one thing. Nope, it's kind of this big umbrella term that covers at least 3 very different feelings. Pinpointing which one you're actually feeling is absolutely key. So this is our roadmap. We're going to look at these 3 main types one by one. First, there's vertigo. That's the classic spinning feeling. Then lightheadedness, which is more like you're about to faint. And finally, disequilibrium, which is all about feeling unsteady or off balance. Let's dive in with the most dramatic one first. Vertigo. It's that intense and, let's be honest, pretty alarming feeling that either you or the room around you is moving when it's clearly not. Now, the most common cause has a really long name, but the idea behind it is surprisingly simple. It's called benign paroxysmal positional vertigo. Whew, that's a mouthful. But let's just break it down. Benign means it's not dangerous. Paroxysmal just means it happens in these sudden short bursts. And positional? That means it's triggered by moving your head in a certain way, like rolling over in bed or looking up at a high shelf. So what's actually happening? Well, deep inside your inner ear, which is kind of the control center for your balance, you have these tiny little crystals. You can just think of them as ear rocks. In BPPD, a few of these little rocks get knocked loose and float into canals where they're not supposed to be. This sends confusing signals to your brain about where your head is, and boom, you get that crazy spinning feeling. And here's the really wild part. The most common way to fix this isn't a pill, but a simple set of movements called the Epley maneuver. A doctor or a physical therapist can walk you through it. The whole idea is just to use gravity to gently roll those loose crystals out of the canal and back into the spot where they belong. Pretty cool, huh? Okay, on to our second type, lightheadedness. Now, this isn't about spinning at all. This is that feeling that you might pass out, that familiar head rush we've probably all had. The number one cause here is something called orthostatic hypotension. It sounds fancy, but it's really just the medical term for a temporary drop in your blood pressure when you go from sitting or lying down to standing up too quickly. Medically speaking, what's happening is a specific drop in your blood pressure, at least 20 points in your systolic pressure, which is the top number, within about 3 minutes of standing up. All it really means is that for a brief moment, your brain isn't getting quite enough blood, and that's what causes that lightheaded feeling. The great news here is that you can often get ahead of this yourself. I mean, the first tip is obvious, but it works. Just stand up more slowly. But if you feel that wooziness coming on, you can try some of these physical tricks. Crossing your legs, or even just squatting down, helps squeeze the blood from your legs back up towards your brain, and that can often stop the feeling right in its tracks. All right, finally, let's talk about our third category, disequilibrium. This one feels really different. It's less of a sensation in your head and much more of a feeling of unsteadiness in your body. So people who experience this describe it as feeling wobbly or just off balance, but, and this is the key, specifically when they're up and walking around. A huge clue here is that the feeling often vanishes the second they sit or lie down. Unlike vertigo or lightheadedness, which usually have one clear cause, disequilibrium is often a bit more complicated. Think of your body's balance system like a GPS. It needs clear signals from your eyes, the nerves in your feet, and your muscles. With disequilibrium, maybe those signals are getting a little weak or confused, so your brain isn't totally sure where you are in space. It's that mix of small issues that creates the unsteady feeling. Okay,
So we've gone through the common, usually harmless causes, but now we have to tackle the big question, the one that's probably in the back of your mind. When should you actually be worried? When does dizziness mean it's a real emergency?
The most important thing to remember is this. It's not usually the dizziness by itself that's the red flag, it's what comes with it. If your dizziness is sudden and it's paired with any of these things, like a sudden killer headache, new problems like trouble talking or seeing straight, a sudden loss of hearing, or actually fainting, that's when you need to get help immediately. Now, these combinations are really rare, but they are the ones you never, ever ignore. So, now that you have all this info, how can you use it to have a really productive conversation with your doctor and get to the bottom of things?
This is so important. Just walking in and saying, I'm dizzy is, well, it's just not enough to go on. But if you can describe the actual feeling using the kind of language we've been talking about, that helps your doctor narrow things down so much faster. It's like giving them a huge head start.
So let's just recap the big ideas. Number 1, remember that feeling dizzy is common and it's usually not serious. But the most powerful tool you have is just paying attention. Can you figure out which of the 3 types it feels like? What brings it on? How long does it last? Answering those questions for yourself is the absolute best way to help your doctor and you figure out what's going on.
You know, when you stop and think about it, our sense of balance is this incredible, silent marvel. This constant conversation happening between our ears, our eyes, our muscles, and our brain. Dizziness is really just a moment when that conversation gets a little garbled. And maybe that's the real lesson here. It's a reminder of this complex, amazing system that's working hard to keep us steady and upright every single day.